In times of healthcare emergencies, reliable and up-to-date information is vital for effective emergency response. And because of the rapid spread and high contagiousness of COVID-19, the need for real-time and actionable data is crucial to minimize the human and economic costs of this pandemic. This is why local chief executives need to execute efficient, actionable data management systems. A basic DMS should comprise these incidents that trigger COVID-19 case management: a positive result of a SARS-CoV-2 laboratory test, a healthcare provider report of a confirmed or probable COVID-19 diagnosis, and the identification of a COVID-19 case through contact tracing. For a comprehensive DMS, the following additional data should be presented according to the EOC manual: negative and positive line lists from all the molecular laboratories, suspect and probable patients from the hospital's emergency room and outpatient department, suspect and probable patients from government and private clinics, and healthcare capacity management data from government and private hospitals. Under the healthcare capacity management data, information about beds, utilization rates, and patient admission rates within the area should be indicated, as these numbers will reflect the locality's capacity to cater to COVID-19 patients and prevent them from hopping from one hospital to another. The DMS involves both collection and sharing of data to healthcare providers, including those in isolation and quarantine facilities and response units such as the Incident Command System or ICS, Emergency Operations Center, and most importantly, the team of contact tracers who must respond quickly to new cases through house-to-house extraction and surveillance. By sharing data, all units can work collectively in implementing effective countermeasures for the pandemic. To ensure that everyone has access to the latest COVID-19 developments in the area, LGUs must keep their communities informed through publishing daily reports, including historical, active, and geographical data on their official communication channels. With comprehensive historical data, LGUs can properly assess the growth of cases over time and use it to implement strategies to mitigate the spread of COVID-19. Under this section, the total number of cases, recoveries, deaths, and testing conducted by local facilities since the first confirmed cases should all be specified. Following historical data is active data, which includes the total number of active cases within a 14-day period, daily count of testing conducted with daily positivity rate, and tally of confirmed cases, probables, recoveries, and deaths. These numbers will keep the community updated with the current pandemic situation in the area. And while COVID-19 affects every community, geographic data is vital to identify the most vulnerable communities. This data includes the list of barangays and their corresponding data for the past 14 days, as well as the total number of occupied or available COVID-19 beds in hospitals, temporary treatment and monitoring facilities, and authorized home isolations. However, such data collection and processing can be a double-edged sword in the fight against COVID-19, as some data can increase people's vulnerability to data privacy violations. Therefore, data collection should be accomplished with due regard to data protection and privacy laws to prevent unjust discrimination, physical harm, and emotional stress. Data collection and utilization should be accomplished in compliance with the RA 11332 or Mandatory Reporting of Notifiable Diseases and Health Events of Public Health Concern Act, which provides public health authorities the statutory right to access personal information to facilitate effective response. The said authorities should also ensure patient privacy and confidentiality of the personal information entrusted to them to safeguard one's data privacy rights.